All right, so now in this video, we are going to work on hip flexion treatment. All right, so this may be soft tissues, this may be joint, all right? Or with many people, it's both. And so 4K here, I'm gonna keep her in neutral, and I'm just gonna kind of try to take her into flexion. Right here, I start to feel like there's limitation somewhere. Now, then I have to ask myself, where do I feel like that's coming from? For her, I feel like there is just kind of a bony stop there, okay? Could be hip, but also could be how her pelvis is sitting. We don't know the answer to that right now, but we will be able to help determine if it might be pelvis, if what we're about to do doesn't help that motion. So the first thing I want to think about is it posterior soft tissue? And then I want to think, is it anterior soft tissue, or are those tissues on the front able to fold onto each other? Or is it more joint related? All right, and so if I felt like it was more posterior soft tissue related, I would take her into that flex position, and then I would just kind of feel around for what brings more tension into those soft tissues. Where do I feel like I feel some amount of restriction? She doesn't have a ton back here, but if I'm gonna be somewhere, I'm probably gonna be about there. And then hold there, Kay, don't let me move you. And let it go. And with my treatment fingers, I'm trying to not hyperextend my fingers. I'm trying to keep a little bit of an arch so that I can use my lumbricals. And then I am thinking about a clock and really kind of pressing my fingers into the direction that feels like the most restriction is present. And for her, it's kind of, if 12 o'clock is straight up, 6 o'clock straight down, it's actually kind of scooping down towards 7 o'clock for her hamstrings back here as they attach into her sit bone. Hold there, don't let me push you up. I'm just scooping down and let it go, okay? So you could really work anywhere along those posterior soft tissues, but hopefully as you go to move that leg up, you're feeling where that restriction might be coming from. So sometimes I feel like it's joint, this is worth saying. Sometimes I feel like it's joint, but then it ends up being posterior soft tissues because I'll still work those first, and then I'll recheck and be like, whoa, where did all this motion come from? I thought it was the joint. So don't skip them just because it feels like the joint. The next place that I would go is right on, oh, she's ticklish. It's right on the hip crease here. So as we bring the leg up, try to just relax that leg. Okay, there we go. I would feel kind of that psoas tendon. Could be psoas tendon, could be TFL. It could be adductors a little bit in here. There's multiple different structures in this area that could cause some restriction, and I'm on, I believe, psoas tendon there. As I bring her up, I get a little bit more of a hard infeel into pure flexion. Now, if I want to localize that further, I can take her into a little adduction versus abduction, a little bit more into adduction, and then I could play around with rotation also. And as I take her into internal rotation, I get a little bit of a harder infeel. And I'm doing the same thing with my kind of treatment hand here, is kind of localizing what feels the tightest. Once I get there, I can say, okay, don't let me move you. And I'm resisting kind of up between her left shoulder and her left ear, as I am also tractioning up with my right hand, and let it go. Good. And I could just continue to work through that, through multiple, and hold there, contractions, until it felt like it wasn't really improving anymore. Good. And then finally, the last thing that I could do is I would want to raise my table up here a little bit. And go ahead and raise up. And so now I could put the belt close to that joint line. I'm going to want to tighten it up a little bit. Again, if you need a towel or something like that, if it's uncomfortable for the client, by all means, you can add a don't add a client between the belt and the client. Add a towel there. And then I would go into that flex position. I feel it start to engage the belt. So at that point, I kind of weight shift back to further engage the front of her hip. From here, I can then further localize into adduction, abduction. Adduction's tighter. Check external rotation, internal rotation. So flexion adduction, internal rotation is most restricted for her. And then I can mobilize into all of those directions. So hold there, Kay, don't let me push you up. Good, and let it go. And I'm just maintaining that tension or blocking the hip from pressing into the belt by maintaining my weight shift back into my pelvis as she pushes into me. Good, is that okay? And let it go. Relax there. And I can see, can I take up a little bit more slack? A little bit more AD, but I hit a block there, so I want to make sure my belt is providing the block, not just compressing her joint. And then right there, and then hold there. Don't let me push you up. Good, let it go. And let's say we're done there. So now I want to re-educate this. So now I'm going to keep her here, and I'm going to switch my hand to the opposite side. Hold the knee up here, Kay. Keep it up there. Keep it up there. Now I'm just almost purely tractioning. Breathe in for me, Kay, and then when you breathe all the way out, bring your rib cage down. Try to anchor the bottom of your rib cage to your pubic bone. Good. Hold that. Hold that. Keep your heel down. So bend the knee. There you go. Hold there. Good. Flex your foot. Don't let me move you. There we go. So I'm trying to connect. I'm still getting a lot of hip because it's not treated out, and let it go. But ideally, I would try and connect that leg back to her core. Now I'd want to feel mostly core firing there. The more traction you can do, the more you can get into the core, and not just crazy gripping in the hip. If it's crazy gripping in the hip, it's not worth doing. You're just building dysfunction on inefficiency, capacity on inefficiency. We don't want to do that. Okay, so that is a long video on mobilizing the hip into flexion.